Hello, I'm Marina. I'm one of the nurses on the burns ward who's looking after your daughter. How are you feeling?
I feel awful. I feel so guilty about my daughter getting burned.
I can appreciate how frightening it was for you and your daughter, but you did the right thing bringing her to the hospital as soon as possible so she could get prompt treatment. Can you tell me about the incident? When and how did it happen?
It happened about 6 o'clock last evening. I was in the kitchen cooking dinner and didn't pay enough attention to where my daughter was. I got distracted and didn't realize she was close to a pan of hot water. Some of the water splashed on her left forearm and burned her.
I'm so sorry to hear that. Can you tell me about any first aid measures you did after the accident?
I kept pouring cold water over my daughter's shirt. I think I did that for about 10 minutes. Then I tried to take her shirt off to see what damage had been done.
That was very good to think of pouring cold water over the burn. Did you put anything on the burned area, like a cream for example?
No, just the water.
Okay, that's good. I'll explain what I'll do now, so you have a better idea about your daughter's treatment. The first thing I'll do is to check your daughter's pain level and give her some pain medication. Then I'll soak her shirt in water to remove it as gently as possible, so I can make an assessment of the burn and make a note of the size of the burned area as well as the depth of the burn. Lastly, I'll put on some special burns cream and cover the wound with a dressing and a bandage.
Okay, I see. I understand what you're doing now.
There are some other things we have to keep an eye on after a burns injury. We'll be monitoring your daughter's fluid intake to make sure she's drinking enough. This usually means offering her small amounts of fluid frequently. Some parents become concerned if their child has a drip to deliver fluids into their vein, but this is only necessary if sufficient fluids can't be taken in by mouth.
Okay, I can help with that.
The last thing to mention is monitoring any itchiness as the burn starts to heal. If it becomes itchy, we can give your daughter some antihistamine medication to reduce the itchiness. The medication may make her a little sleepy, but it will prevent tissue damage from scratching the area.
Okay, I understand, but what I'm really worried about is scarring after the burn heals. I think she should be referred to a specialist.
I understand why you might be concerned about scarring after your daughter's injury. I can reassure you that your daughter's treatment plan will include the management of scarring. It's important to mention that scars can take up to 18 months to fade. However, there are some things that can be done in the short term to help your daughter. You'll be taught how to massage any scars your daughter has, to help flatten them. It may also be recommended that your daughter wears a special garment during the day and at night time. It'll be made to her arm measurements and will put constant pressure over the scar to help flatten it. As she grows, she'll be given a new pressure garment. Do you have any questions you'd like to ask about what I've just told you?
No. I feel reassured now about my daughter's treatment plan.
Great. Now, I need to check your daughter's clinical observations and do her dressing. Are you willing to give me permission to do this?
Yes. I'm willing to give you permission to do her clinical observations and her dressing.